Okay, the next segment of dissection is cavities. So today we're going to be opening the thoracic and abdominal pelvic cavities. Now, if the company that prepared the cat made their incision for the abdomen on the sides, then you have to make an incision along the midline of the cat. If that's where your company already made the incision, then you can skip that part. You're just going to make an incision through the muscular wall, just large enough to get your scissors through, because scissors are going to be better than scalpel. If you have a blunt edge goes towards the organs. Now you're going to lift up in the abdominal wall, because you don't want to be cutting like this and cutting through organs. So lift up, insert the scissors, and whenever you're doing incisions against organs, you're going to lift that tissue so that you're not cutting through organs. Now you're going to go high enough to where you meet the diaphragm. Oh, crap. Now the diaphragm, remember, is the natural barrier between the two cavities. And it's a skeletal muscle that goes up underneath the ribs. So all you have to do is palpate where that diaphragm is. I still have about that much farther to go. And you don't want to cut off the diaphragm. That needs to remain intact for your points. You just want to cut up to it. This is fat. Okay, so I'm at the diaphragm. Now we're going to go to either side of the sternum to open the thoracic cavity. So to do that, you don't want to cut through the sternum because that's bone. So go on either side, and it doesn't matter, whichever one's more comfortable for you. And just make sure that you're above the diaphragm. Okay, there's my finger. So as long as I go here or up, we're fine. We're just going to poke and get in between the ribs there. Now, you're going to lift up on the cavity wall, and we're cutting through costal cartilage here, which is a lot easier to cut through than bone. So as we cut through that costal cartilage, lift up and cut. And you're going to do that all the way to the top of the thoracic cavity to where you can't cut anymore. Not all the way up through the neck. Now you're going to turn around and go the other way until you meet the diaphragm. Not go through the diaphragm, just meet it. Okay, so I'm right about there. Now you're going to make a lateral incision that follows the diaphragm. So you're going to lift up so that you don't cut the organs inside, and make an incision down along the lateral side. You may have to go through a couple of ribs. Ribs tend to be pretty thin in the cat. Shouldn't be too hard to go through. What you will need help with is going through the sternum so that you can continue your dissection this way. What you need to do is take your scalpel and just clear the soft tissue off from the sternum, and then call me over. And I'm going to use my bone cutters to just get through that sternum for you, just like that. And then you're going to continue the same incision down this way. Okay. So I'm lifting up so that I don't cut the lungs and the heart. And I'm just following that diaphragm. You can see me feeling for it. Make sure I'm not cutting it off. Okay. Now once you have those incisions made, you're going to separate the wall of the thoracic cavity from the organs, like this. Get a little bit of that fluid out, preservative and from washing out our cat. And you're going to take your scalpel and score the ribs, meaning you're going to cut along the bottoms of the ribs as far back as you can to make a little cut along them, and then you're going to push. And that's going to relieve the tension of the wall of the thorax so that it stays open and you can view your organs. Okay, so I'm going to do that on the other side. And push. Like that. Now you've got a nice thoracic cavity. Okay, the next thing you're going to do is continue your abdominal incision. And you don't want to go all the way to where the abdomen ends, because the bladder of the cat is actually attached to the abdominal wall. So you're going to leave about 2 or 3 inches above the end of the abdomen, and then go to where the hip is, or where the leg meets the body. That way you don't cut through the abdomen. Sorry, through the bladder. Okay, if you lift this back, there's our urinary bladder. Nice sac. And it is attached to the abdominal wall with a ligament. This membrane here is called the median umbilical ligament. Do not cut that off. Okay. Alright, now the abdomen isn't open. Walls want to stay closed. You're going to go below the diaphragm and make the same incision down as you did above the diaphragm. Careful not to cut the diaphragm off. So I just look up under there and say, okay, there's my diaphragm. And I make my lateral incision. Walls are open. Okay, now you'll notice that it's kind of yucky in there. There's some congealed tissue, some hair in there from when the company made their incision, and some of that hair has gotten into the cavity and all that stuff. So again, once you're done with your incisions, you're going to take your cat over with your lab partner, whole thing goes over there, stand them up in the sink, and rinse out the body cavities with the hose. And gently kind of rub the organs as you do that, so that it gets all of this hair and congealed, paint and tissue and blood and stuff like that off from your cat.